Hello, welcome to another show of the Research to Reps Roundtable. I am your co-host, Dr. Coach Pat Ivy, and with me, our co-host, Dr. Ted Lambrinidis and Dr. Ernie Reimer. First up, Dr. Ted, I want to know, how are you doing?
I'm doing outstanding. You got big football game there in the Ville this weekend, correct?
Oh yeah, It's a big one, biggest one since I've been here. So this is exciting, very exciting. Dr. Reimer, what do you think? What's going on? Like your hat.
Thank you. I think that like you two already mentioned, I'm very excited for the upcoming game this weekend, and I'm excited for this guest we have today. Very interesting guest, Dr. Farooqui. Dr. Farooqui, thank you for being on the podcast. It's an honor to have you here. Would you just take a minute to let us know how you're doing and share a little bit about your background?
I would love to do that. Hey, guys. So Ali Farooqui, it's a pleasure to meet you guys. I'm a medical doctor. I'm a psychiatrist here in Louisville, Kentucky. I'm associate faculty, clinical faculty at the University of Louisville. And we also have a private practice here with my partners. I came into psychiatry by way of neurosurgery, where I was actually over where, Pat, I think you were down in Missouri for a little while. Yes. But happy to be practicing in the area of brain health and brain performance. And our focus, other than just regular psychiatric illness and treatment, is actually in the use of neuromodulation, brain stimulation, and also interventional psychiatry, which is a budding, up-and-coming field involving the use of, brain stimulation techniques and also other medications like hallucinogenics or ketamine, et cetera, for the treatment of mental illness and other neurological disorders. So I'm really excited to be here and participate and talk with you guys.
I don't think we're going to have any trouble, Dr. Farooqui. We say we like to get dirty and nerdy on this podcast. We don't have to get so dirty, but we do like to get nerdy. And anytime you can, don't be afraid to really go there and then bring it all the way to practical application. I think our listeners really they really like that.
I'm excited for it, man. I love the layout here.
Well, I'm going to get down and dirty. I mean, I hear you say neuromodulation, brain stimulation, and like the first thing that came to mind was this movie, probably from like the late 80s, early 90s. It's called Strange Brew, and the two brothers, they're Canadian, and they go in, they sneak into the asylum, and they're giving each other like shock therapy. I don't really think that's what you're talking about, but could you like, clear the air here and like just set the record straight? Like, what do you mean when you say neuromodulation and brain stimulation?
Yeah, that's a great question, because I'm so wrapped up in this world that I forget that a lot of folks still associate brain stimulation to electroconvulsive therapy from the yesteryears. Weirdly enough, ECT is still actually used. It's pretty effective in some very severe types of mental illness. Your psychosis, your schizophrenia patients, your vegetative depression, your catatonic patients, those classical pictures that you see of folks that have their extremities stuck and not moving, and they're not able to feed themselves or do anything like that. So ECT is still used. However, that's not really what we mean when we say neuromodulation in the modern sense. So over the course of the years, what we have noted is that there's certain areas of the brain that we can identify that are not working up to their full potential whenever individuals have certain types of neuropsychiatric symptoms, things like depression, things like anxiety, in addition, OCD, for even some addictions. What we've also noted is that there are certain other conditions where parts of the brain that are involved with resilience and grit and perseverance, that they are not really catching up and doing what they need to be doing to help that individual perform to the best of their ability. So things like chronic pain, right? So as we know, pain and recovery from a significant injury without developing chronic pain, that involves more than just tissue healing. That involves a certain level of psychological and neurological healing as well. And now those areas of the brain have over time been identified. We still have a long way to go, but we have a pretty good mixture to start with. And what we can do is stimulate those areas of the brain using magnetic pulses. And we can localize the magnetic pulses. We can isolate areas of the brain using your anatomy and using also image-guided neuronavigation. And we can really pinpoint portions of the brain that we think would help treat or optimize the response in one of our patients. And that's really what modern neuromodulation is. And that's just the surface. There's a lot of neuromodulation going on underneath too. For example, folks have spinal cord stimulation for pain is a neuromodulation technique. And so is, vagal nerve stimulation for seizures or for depression, et cetera. So there's a lot of different sub-avenues here. But that's kind of what we're going to be talking about, and what I'm interested in, and what our expertise is in our practice is the non-invasive brain stimulation using magnetic pulses.
Dr. Farooqui, I try to do something on this podcast, and I look at Ted and I try to read his mind and ask a question that he's thinking. So, Dr. Ted has an awesome background in sport and research, and he's probably thinking, how could your research or background enhance athletic performance? Can you go there for us?
Oh man! First of all, Ted, is he right? Is that what
he's exactly right? It was amazing.
Gosh, this is such a cool topic. And I frankly love this topic because this opens up so many areas of exploration and so many areas of application as well, not just with athletes, but also with patients in general suffering from other types of disorders. Let me start by saying this. There are certain brain circuits that are involved in not just learning, but also emotional regulation, resilience, perseverance, etc. There seems to be certain relay points or nodes in the brain where a lot of those wires get crossed like a little switchboard and then branch off, okay? And what we try to do is isolate and stimulate those nodes in this network so that we can impact multiple circuits at once if we need to. One such area appears to be the left dorsolateral prefrontal cortex, which roughly speaking is about here-ish, right, on the left-hand side. This area is actually the FDA-approved treatment site for depression. But what we've noted is that this stimulating that area actually improves outcomes in a variety of different disorders, but also improves outcomes when it comes to cognition, when it comes to memory, when it comes to learning, visual learning and motor learning as well. So when you talk about the use of brain stimulation for athletic performance and to help athletes, we really can go into two separate areas. We can go into one area, which is taking away the negative. So addressing the nerves when it comes to the pre-game nerves or post-game nerves, addressing, confidence issues and the mood in general when it comes to the mood to perform is the mindset of the game, etc. Also, when it comes to pain, if someone has has an injury from last season that they're struggling with and they're having a difficult time really rebuilding that muscle, the brain to muscle connection, then that's a place where brain stimulation can have a role. So that's one side of the coin. The other side of the coin is enhancement of performance. in the absence of a pathology like depression, like anxiety, like pain, like something else. And that's really a completely different area, because stimulation of certain brain networks and certain brain nodes might actually improve performance in and of itself, increase reaction time, decrease reaction time, increase your reflexes, allow for better cognitive awareness, a better concentration to what's going on the ground or on the field. So there are really two different areas that we can go into with this.
Yeah. There's a famous quarterback at the New York Jets who, went into a cave this offseason and was a big proponent of, the use of psychedelic substances. And what's your opinion on that? Because, you have athletes that obviously sometimes experiment, but they're also subject to drug testing procedures. So, but both from an efficacy point and as well as not failing a drug test, what's your opinion?
So, that's such a good question, and I'm glad you asked that, because there's not a really good answer that I have, which is important, I think, to discuss also. The areas where we don't have really good answers. So I know what you're talking about. I think this individual was also at the annual meeting for the psychedelic medicine down in, I think it was Colorado or something like that, this past year. But so, in our practice, we utilize ketamine. Ketamine is a dissociative anesthetic. It is used, and it's actually FDA approved for the treatment of depression as well. We use it in IV format, which is not FDA approved, but is found to be effective for the treatment of depression. The mechanism that we're talking about with brain stimulation versus psychedelics is different. With the psychedelic experience, there seems to be a synthesis. There seems to be a change in the way that you view what you're doing in your environment. And so one of the common feedback that I get from some of my patients that undergo ketamine infusion, specifically for pain, I'm going to talk about pain right now specifically, then what they say is that it's not that the sensation of pain goes away. It's that they interpret it differently. That where they can still feel when the pain is, they can still feel where their chronic pain is coming on, they can still feel the exacerbation, but their interpretation of what that sensation is changes. And I believe that that's might be what's going on in the world of, high performance athletes, where having a psychedelic experience might change the way that a game or a role in a team is approached, where it might take the ego out of it to a certain degree and allow for the analysis of the bigger picture or the larger picture. There's no proof for that, and I think the changes are very subjective, but they're palpable because we hear them from patients and from the media, lay media and the academic media alike. But that's not what we do with the brain stimulation, though. And I think that those are two completely separate things. Like they might be synergistic or they might not. We don't really know the answer to that. But with brain stimulation, what we're actually doing is we're essentially personally training portions of the brain by repetitive stimulation and building new ways of brain firing. I don't know if that made sense or not. That's
No.
But maybe I skirted the question there a little bit. I don't know. But it's a pretty. But I think the psychedelics world is about to explode quite big, quite largely. So, yeah. So where do you guys see? Let me ask you guys a question. So when it comes to because classically, at least when I was growing up, I played sports in high school, but nothing after that. But physical performance was really the main crux of any kind of development as an athlete, but mental performance really was not. And this is in the 90s and early 2000s when I was in school. So how have you guys seen brain performance change and the value that brain performance now has within the athletic world. Where do you guys see this?
That's a really, really, really good question. I wish we were further along in the exploration of that. I think there's been some good work done. I think it's been isolated, maybe in certain areas of the I guess of the world. We typically have not explored how brain health, mental performance can help us with athletic performance the way we have with other areas. We are implementing a very good mental performance strategy and curriculum, but I would tell you, mental performance and mental health have been separated in many areas, especially maybe in athletics. Mental health tends to be, if something's wrong with you, then you go see this person. Mental performance has been something where you bring in someone from the outside and they give you a good motivational speech, or maybe you take some personality test and then that person leaves and maybe comes back 3 months later and gives a session 2 there, and there's not much implementation of education. There's not really a curriculum involved. And I think that's something we're working on implementing, and we're doing a good job of it. But still, the recipients of that don't really understand what it is. There's still a perception that maybe we should be doing mental performance one-on-one with athletes, or having maybe it's in a team meeting. But when you're doing real mental performance, the people, all the practitioners, the coaches, the administrators, everyone needs to understand and know or have a good knowledge base of what the basics are of mental performance, and teaching skills of focus, teaching them the importance of arousal control and emotional stability. That is something that you won't find in many places where that is living in a program and in the environment. I think that's something we're working on, but that philosophy is counter to the message even coming from the professional organizations. The professional organizations are saying the best way to implement mental performance is from the bottom up. And we're challenging that and said, not just teaching the athletes, but teaching the coaches and the leaders what mental performance is, and trying to create an environment that cultivates the use of skills and understanding, and the importance of understanding how the brain works. And I think when you do that, stigmas, they're gone. People are more likely to search for help. Even the people that are trying to help people are more likely to get help, and which helps. So does that answer your question? That's just a little, I think, to answer your question.
No, it did. It's great. I see, Dr. Reimer, you have you got a smirk on your face there.
Yeah, I just think it's just hearing some of this and hearing the work that you do and what Dr. Ivey's talking about is just so interesting to me. I'm just curious to know, like, because you talked about how we can take this in 2 different directions. Like, you can use neuromodulation to take away the negative, and when there are not different types of mental health concerns or otherwise disorders that are present, like, you can use it for performance enhancement. And I'm just curious to know, like, at what point in time do we, like, walk across the bridge from what Dr. Ivey's explained? You have this performance psychologist, this mental skills coach who's interacting with coaches and athletes. And at what time in that process do you go from the human interaction and making the recommendations and and walk across it. Now it's time for neuromodulation to take your mental skills and your performance to a new level. Like, when do we know it's time to do that?
Yeah. That's such a difficult question to answer, because I don't think that there is a well-defined time, right? So there's a couple thoughts that I have about what you just asked. The first is, there is a from a neuropsychiatric perspective, the culture of treatment is not the same as the culture of treatment behind physical health, right? So, for example, the whole idea of, if there's something wrong, then you go here for treatment versus you go here for optimization. But if you actually think about lifestyle changes for diabetes, for cholesterol, et cetera, preventative medicine is delivering care in a way that you protect the individual from requiring treatment for a disease or disorder to begin with, right? And so we don't really have that as much, and if we do, it's not thoughtful in psychiatry or in mental health, because we're still struggling with the delivery of care when someone needs it, that we're not really at a point where we can work on preventative measures, right? How do we impact a culture? How do we address the mindset of a student athlete or a professional athlete, where they're able to be in a state of learning, where failures don't get them to be depressed, where they can perform with confidence, where they are, the hits that they're going to take, both literal and figurative, are not going to chip away at at their fortitude, their psychological fortitude that they've developed over time. And I don't think that we're fully there yet, but I think that you guys are kind of the spearheads in this area. In terms of when we cross that line from treatment to activation and to amplification, I think that you think about optimization day one. So my philosophy is that when a patient, so excluding athletes, if any patient that comes in through my door, my philosophy isn't that I'm going to simply treat this person to a certain degree, right? My goal is to treat to remission. My goal is to get this individual optimize their life, their mental and emotional and psychiatric well-being to the best possible outcome. So my goal, that's my goal. And so I'm think about what tools I have in my tool belt from the front end. I think about that as soon as they come into my door. I think about, all right, is this somebody that may in the future need neuromodulation, that may need an interventional procedure like ketamine or other types of, or TMS, transcranial magnetic stimulation, or other types of neuromodulation or neurofeedback type approaches that we utilize? Is this somebody that I need to start thinking about that now? Laying the groundwork now? Is the data that I'm going to collect, is that going to help me in my decision-making down the line? And I try to be very thoughtful in collecting that data so that I don't waste that person's time, because their time is valuable. They only have us, why would I want to prolong misery if someone is coming in feeling not well, right? So I don't want to prolong that. And why would I be okay with 20% improvement or 40% improvement? I should shoot for 100% improvement, and strive for that. Even if we don't get there, we want to strive for that. That mentality is not pervasive in mental health and brain health in general. One of the reasons is because mental health is difficult to deliver. One of the difficulties is the language that we use. We still use the word help instead of treat. Even though I know that there is a specific brain pattern that I can see for depression and anxiety on functional brain imaging, I know that there's a brain abnormality associated with these disorders. I still say, hey, do you need help? I don't say you need treatment. and I'm guilty of that as well. But we're still kind of in that stage. I don't know if that answers the question or not, but I feel like we're still at that stage right now.
What's your opinion? I've had athletes that who are looking to optimize performance, and they'll say, "Hey, what's your opinion of the transcranial stimulation units that look like a headset?" Prior to going out for a game, and I've seen the transcranial stimulation units that are $500,000 versus this headset. So, what's the difference, and what's the efficacy of those treatments?
It's a blunt instrument versus a fine instrument, right? So the ones that we use, we use what's called transcranial magnetic stimulation. Now we have some of the other instruments as well, so instruments that are peripheral vagal nerve stimulators or auditory nerve stimulators and things like that. So we utilize those for different patients as well. But the idea is what is the severity of the issue that I'm trying to address? Number one. Number two is, how much supervision does this require? So is this something that I can give somebody to take home and they can plug it in? Is this somebody who's highly motivated, who's like willing to get better, and they're going to follow through on this? Or do I need somebody to come in, sit in my office in our TMS chair, and our tech will place the coil, the stimulation coil, with millimeter precision, down to a fraction of a degree of change in terms of the curvature, et cetera, and that we stimulate the same area of the brain exactly the same way, with exactly the same frequency, at exactly the same time, et cetera. So it really depends on what we're trying to do. My personal belief is that the TMS, or transcranial magnetic stimulation, comes in two different forms. There's a helmet that goes on, which is a deep TMS that stimulates deeper structures. There's also a figure-of-8 coil, which looks like a literal figure of 8, and you can position that around people's heads, etc. And those are snipers rifles, right? So they are high-powered, localized area. We can target specific portions of the brain. They're fine-tuning instruments to be delivered under the care of a professional who's trained in delivering that kind of care. I think that the blunt instruments also help. I think that they do help. I think that the fine-tuned instruments are probably going to be better. They're probably going to be more efficacious, depending on what you're trying to do. If you're trying to, treat a pathology, then I would opt for then depending on the patient, you could go either or, right? But I think
this would be, you see this in NBA players that are out there in pregame during shoot around with these units on, and they've asked me, well, how beneficial are these? And I can't give them a correct answer within that environment.
And same, right? Because there might be some studies out there that look at those auditory units, the results that they show on cognitive performance. But the data that I've reviewed and that I've looked into and that I present on in various situations, they're surrounding targeted stimulation of the dorsolateral prefrontal cortex. So it's kind of like the top down versus bottom up approach, right? So when you think about vagal nerve stimulation, so you are stimulating a nerve that has fibers that go into your brainstem, up to your thalamus, and then spread over to the rest of the cortex of your brain. So that is from the bottom, you're affecting a change up. What we like to do is affect the change from the top down. So we identify the node that has projections to different parts of the brain and then goes down into those fibers that are in the peripheries. So it's really bottom down or top down or bottom up.
Like when I hear like top down, bottom up, I start to think about like organizational leadership and influence stuff. I mean, you think we could put like one of those like figure 8s on like organizations and just like center it on the front office of like sport organizations who have really poor leadership and just like nuke it, and then all of a sudden like we have all this amazing top down leadership?
Man, I don't know. From if you guys are the leaders here, and from what I'm seeing, I don't think we need to do anything. You guys are doing such an amazing job. I'm proud to be U of L guy here.
In all seriousness, though, I think I'm thinking about Ted's, where he spends a lot of time, and that's in the NFL. And like in the NFL, there is, and I pulled it up here. It's the Joint Pain Management Committee, and their job is to establish ways to address the challenges of pain management in current NFL players, and to facilitate research that can understand this issue more. I do know they put out a call for proposals, and they had grant funding recently. So this is a major issue. And I was first introduced to this working with a college football team, and I would sit down and I come from a physiology background, but I would talk with players about like their habits and things that can affect their performance, and from a more of a physiological lens. And a lot of players would come to me and they'd talk about, if I could only just get rid of this pain that I feel from my past injuries, I would be so much better. So my question, Ted, Dr. Farooqui, are either of you aware of like some of this work being done in professional sport that's specifically oriented toward pain management, like in elite athletes?
Not aware of it, but gosh, what a great opportunity here. So we presented a paper at the Clinical TMS Society this past year in Colorado on pain management and the use of transcranial magnetic stimulation for pain control. There is a decent amount of data surrounding it, but we presented some of our experience with it. There is a pain matrix, right? So pain is not just pain. Pain is not just pain fibers from the tissues going back up to your brain. There's more to it. There is a fear component to pain. There is a cognitive component to pain. There is a motor component to pain. There is a sensory component to pain. And so there's a pain matrix that has been pretty well defined in portions of the literature. You can target pain relief in any of those different areas, but once pain becomes chronic, quote unquote, or once you encode the pain in the matrix, then you really need a multimodal approach to target it. You can't just say, all right, we have to address the broken bone and that's it, and we're good to go. The patient will recover. They'll be able to go back to their performance. That's not really the way it works, because once that's encoded in the matrix, there's a fear component to it, which changes the biomechanics of the patient, and it changes the way that the person would engage in activities, the way that they use their limb, the way that they approach how they're going to use their limb. And so there's such a depth to it. What we have noted, and what the literature has noted within psychiatry, is that if we were to non-invasively stimulate the motor cortex of the brain, which is, your M1 area. It's the, if you remember those homunculus and those weird kind of body parts and things like that. If we were to stimulate the motor cortex of the brain and follow that up with stimulation of your dorsolateral prefrontal cortex, which is kind of your resilience, your cognitive control, your emotional regulation, et cetera, then you do see a decline in perceived pain over time. Some of the studies that were done, there's one really good one out of Mexico that looked at utilization of physical therapy and the pain response compared to physical therapy versus transcranial magnetic stimulation, and TMS actually outperformed physical therapy even, because you are changing the way that you are processing pain. It's not just that you're changing what you're feeling, you're changing the way that your brain is processing the signals themselves. And that is an area that you can just expand on greatly if given the opportunity. So that's, I'm so glad you asked that. That's so cool.
Ernie, it's when you mentioned the joint committee, there's some irony within that, because the word joint can also be used differently. there's it's the players trying to there's always concern about the misuse of opioids, and so they're looking at the use of cannabis as an alternative for pain management. And I think that's part of this joint committee, is to minimize the use of opioids and perhaps increase the use of cannabis. But I think this brain stimulation is an avenue that probably needs to be looked at much more aggressively by the NFL and the NFLPA. But Pat, why don't you comment? And when you look at pain management in the NFL, the use of Toradol is still probably rampant. So what was your experiences in the NFL there, Pat, with regard to that?
Well, I tell you, that happened a lot. That would be in the training room. That would be with the doctors and athletic trainers. It's not something you saw. And if you didn't know where to go, you would sometimes see a line of players and like, what's happening? When you first get into the league. But I tell you, in college, I've seen it as well. Previously, where the team doctor was in the equipment room, where we would pass out, and players would be lined up to get the shots pre-game. And sometimes we would actually train pretty heavy the day after the game. They still wouldn't, the effects of the shot would still be in their system, where they still hadn't been able to, they didn't feel anything from the game. We lifted the next day, they still didn't feel anything. And then probably by Monday or Tuesday, the shot had worn off, and they realized that, wow, I don't feel so good. It's amazing, that whole thing. I do have something I want to talk about, because I'm fascinated by pain. I had a conversation with someone recently, Dr. Farooqui, and we're talking about scar tissue, and where scar tissue throughout the body has some sort of connection to the brain, and how treating the actual scar is necessary. You can't just leave the scarring there, and not just the scarring on the surface, but the scarring beneath the surface, wherever it is, in the tendons, ligaments, muscles. What do you know about that, or have you done any research, or what have you read?
I don't know much about that, but but it makes sense, right? Because if we classify pain as a matrix, as a complex multifactorial process that goes on, that it involves aspects of our body that we may not even yet be aware of, right? For example, the lymphatics, right? What role do lymphatics play in pain? I had this to piggyback on the conversation that you had. I had a conversation with one of my mentors a few weeks ago, where the lymphatic system is the only system in the human body that we don't really have any really large diseases attached to it. For some reason, it's just something that people forget. We have diseases with neurological system, cardiovascular system, respiratory system, everything, musculoskeletal system, lymphatics, who knows? But I think that there are a lot of components to it. With scar tissue, scar tissue is not very vascular. In fact, it's avascular in a lot of cases, and it does not have good blood flow, and it limits and so these signals that travel from that tissue to the brain are going to be different than the signals that travel from a very vascularized tissue to the brain. So there is probably something to be said about that. The specifics of it, I'm not too sure about, but there probably is something to be said about that. Addressing the multimodal approach to treating an individual and optimizing that individual's functioning should include addressing the remnants of prior injuries and the stigmata of scars and injuries and the wear and tears, etc. So absolutely.
Yeah, I've got one more question I can sneak in, because I know how time flies on these podcasts. Can you talk about vision and obviously how the connection between our vision, our brain, what we see, thoughts, and maybe therapies that you are able to maybe offer, or what have you experienced that I don't really have a question. I just want you to talk about it.
By vision, you mean like the actual physical vision, your what you're seeing.
Yes.
Right? Yeah. So the the vision. So what comes to mind immediately is EMDR, right? So for specifically for the treatment of patients with PTSD and trauma. So there is I'm of the belief that the way that we interact with our environment, that changing or intelligently changing the way that we interact with the environment will have an impact in the way that we perceive our environment, right? And so whether that's light therapy, whether that's music therapy, whether that's, visual therapy of some kind, of which EMDR is a portion of, whether that's, TENS units, for example, is the way that you perceive your environment, right? Is the vibratory sense. It changes the way that you are going to process the sensation in those areas of your body. So I'm of that belief. And I think that vision plays a role in that as well. Now, the way that EMDR is used, and I'm going to do a really poor job of describing this, and some of the therapists that you guys know are probably gonna say, hey, get this guy out of here, what's he talking about? But one of the ways that that EMDR is thought to work is that certain movements of the eye change the way that that your brain is used to firing. So it changes brain firing based on changing the patterns with which you are used to. So it's that same, it's like switching up a workout. So when you reach a plateau, right? So you switch that up, you challenge your brain, you challenge your body, and you create a different pattern, a different feedback loop. And that's the way that EMDR, at a very 30,000 feet view, that's kind of the way that EMDR is utilized. I don't know of any overt visual stimulation that is used for performance or for treatment of psychiatric illness. Now, we have in the past, before I joined my practice, my partner actually has done brain stimulation of the visual cortex, which is in the back of your head, for visual hallucinations. And there is data out there for people with pathology that involve visual hallucinations, et cetera, to have to be stimulated in their visual cortex for improvement of some of those symptoms, with some pretty good results, actually. So that is an area that I don't think is explored as well as it probably could be or should be. And that's kind of the case for most of what we talked about. It's like there's so many opportunities here for development and growth, and we just haven't explored them yet. Is that an area where you see utility with the athletes? Like, are there specific things that you've noted within the visual fields, within the visual cortex and the vision itself that is causing impairment?
Well, Dr. Reimer probably can speak to this more than I can, but I know we're doing something, and we're having some exploration around cognitive I guess treatment or cognitive training, and I was just trying to see if there was a connection between any vision, and I probably should have thrown the word cognitive in there, and that probably would have connected what you were saying to maybe some of the things we're looking at. But Dr. Reimer, what do you have to add to that?
Yeah, so we work with a group, a local group, and they they're focused on using some like vision and cognitive training to help recover from concussions and TBI. And I think that the work seems promising. It may be under-researched, but I think there's an opportunity, and this is something that we've been exploring. So, what's that?
Sorry, I didn't mean to interrupt. Please continue.
Yeah, and so I'm learning about it now. They're in the same lab that I'm in the athletic department, and there is like it's well attended. The athletes come in without any previous head injuries, but they're also coming in just for visual and cognitive training and the potential benefits from that. So I suppose like that can kind of bring up two questions, and I'll let you pick which one you might want to answer. Because in one case, the visual and the cognitive training is being used to address concussion recovery. And then in another case, they're coming for the visual and the cognitive training for just a performance enhancement. So earlier you mentioned brain health. So like, does some of the work you do play into possibly maybe helping to reduce the effects of a concussion before one may occur, or to help someone recover from a concussion faster? So one question would be to maybe talk about brain health and how your work might help with concussion. The other piece would be, you know, in the world of sport, when the line between winning and losing is so thin, and if there is work here in the performance space, does the high level TMS ever just become a modality? You come in and you're using TMS from day one purely for performance enhancement, just like some of our athletes are trialing with the vision and cognitive training.
Yeah, I'll to answer your second question. Yeah, absolutely. There's a role for that. There's I think I mentioned to Dr. Ivy before, but I know of an individual who is in the industry side of TMS who actually zaps himself every day. So he fully believes in the benefits of it, and in terms of the cognitive benefits, the pro-cognitive benefits of it. So he zaps himself every single day. I think that there is validity behind that. So when I describe TMS, I describe it as a personal trainer for the brain, right? And when I describe using TMS in conjunction with other therapies, whether it's cognitive therapy, like talk therapy, whether it's ketamine therapy or other types of psychedelic/dissociative therapy, when I utilize these things together, then I use a snow globe analogy, right? Where certain types of therapies are disruptive, where they're shaking up the snow globe, right? So if you have a snow globe with the flakes there, you shake it up, everything's up in the air. TMS makes sure that the flakes fall exactly the way that they should to get the result that you want, right? Now, if the things aren't shaken up, then the other thing that you can do is you can use TMS still as a personal trainer. You can utilize TMS to build those neural pathways and force them to fire that they might not be firing right now. And there might not be any kind of a physiological way for those pathways to fire to begin with. So there is a role, I think, for TMS. And this is Ali Farooqui opinion, but I think there is a role for TMS in improving performance, cognition, and response, emotional balance, etc. I think there is a role for TMS in those areas. And in terms of concussion treatments, there's an ample amount of data for transcranial magnetic stimulation in concussion. Good data. And like any kind of data, you'll find some for, some against, etc. But TMS has been neuromodulation, TMS, and direct current stimulation, which is essentially electrodes on the scalp itself. They've been used for stroke victims a lot. So people who've lost their ability, who are aphasic, lost their ability to speak after a stroke, using stimulation to kind of force those areas of the brain to wake up and look at their response. There's some pretty good support for that within the medical literature.
Awesome.
That's a little bit of a teaser there, you know. So
Yeah, I like it.
can expand on that later if we want to.
I snuck in there and got 2 questions in, so thanks.
Hey, that's awesome. It's you know, I like to I know that you were right about time flying, because it's I can't believe it's already at the top of the hour here. But I do want to say that I really do appreciate the work that you guys are doing in terms of raising awareness for mental health treatment among athletes. I look at student athletes and just athletes in general as a vulnerable population, because the very nature of what they do almost makes it favors them not seeking treatment for certain psychiatric conditions and certain mental health issues. And so the fact that you guys are doing what you're doing, and by inviting me and opening this dialogue, I really appreciate that. I think that is of paramount importance.
Dr. Farooqui, I know that you're a busy person and you probably have something scheduled. So Ted's got one last question for you, and then we'll wrap it up.
Of course.
Yeah, Doc, what reading recommendations do you have for our listeners? And it could be on this topic or stuff that you're doing for, you know, professional development.
Yeah, absolutely. And you know, it's the first is that mental health, psychiatric disorders are brain disorders that have emotional manifestations instead of other motor manifestations or other manifestations. If you are struggling and suffering from depression, anxiety, or any other psychiatric condition, that is a brain problem. That is not reflective of strengths or weaknesses as an individual, character, or anything like that. These are brain problems. When you seek a physician or any other provider to treat these disorders, you're not going there for help. You're going there for treatment. And I think that clarification needs to be made, because there's almost a negative connotation with the word help in this realm, especially among your audience, you know, where, you know, hey, do you want help to do this? It's like, no, I can do this myself, right? But that's not the way that these things work, because this is not about help. This is about treatment. This is a brain problem. I can look at the abnormality on an MRI, a functional MRI. Your brain is working differently when you have these disorders. And so the message that I would like to give the viewers is that this is a neurological problem that has an emotional or behavioral manifestation. You know, please recognize that and don't hesitate or be afraid of any kind of stigma or judgment when you seek treatment from a licensed professional.
That's wonderful. Well, Dr. Farooqui, we're going to sign off. Thank you for your time, your knowledge. This could have gone forever. I'm looking forward to future collaborations, communication with you, and want you to have a great day.
Thank you guys for inviting me. This has been such an honor, and it's a pleasure to see you guys, to see you again, and to see you guys for the first time and meet you guys. Thank you so much.
Likewise. Thank you.
Take care.
Take care.